Hello everyone, let's get started. Today we're going to be talking about infectious pathogens and how they spread. Our topics for today will include a little bit of history about our understanding of infectious disease. We'll talk about the features of infectious disease, the sources for pathogens, and how pathogens are transmitted. In previous lectures, we talked about the history of microbiology, including the past beliefs that people have held about the origin of infectious disease. The most ancient of these beliefs was that infectious disease, and in fact all disease, was the result of the spirits and the gods being displeased with human beings. It was Hippocrates who put forth the idea that disease was the result of an imbalance in the four humors of the body. Next came miasma theory, which was the theory that bad air was the cause. Bad smells and bad air was the cause of infectious diseases. Contingent contagionism built upon miasma theory and suggested that once a person became ill from exposure to bad air, they could then pass that illness on to other people. They could become contagious. And finally was the zymotic theory, which put forth the idea that there were things like yeasts that were inside the human body and were fermenting and causing problems that led to disease. Ultimately, germ theory prevailed and is still our most current understanding of the origin of infectious disease. Germ theory states that certain diseases are caused by microorganisms, and that it is the entry of those microorganisms into the body where they grow and replicate, reproduce, that is the cause of disease ultimately. Remember, germ theory was credited to Louis Pasteur, although several scientists contributed to the development of that theory. And of course, Louis Pasteur contributed more to the field of microbiology than his contributions to germ theory. He was a chemist. He helped outline the chemical processes of fermentation by microbes. He also helped to develop the first vaccines, including a vaccine for chickens against the avian form of cholera, the anthrax vaccine against Bacillus anthracis, and the vaccine that protects from the rabies virus. And of course, Pasteur is also famous for developing a technique called pasteurization, which helps protect certain liquid foods from spoiling due to the growth of microbes. There are a couple of other names that we should be familiar with as students of microbiology for their contributions to the field of microbiology. Semmelweis was a physician in Vienna who is credited with pioneering the practice of hand washing. He suggested that washing of the hands was critical as a routine part of medical practice. He realized that hand washing could help reduce the spread of microorganisms from physician to patient. And of course, hand washing is still recognized as the #1 way to reduce the transmission of disease. It helps to reduce the transmission of the viruses that cause the common cold, the influenza virus, and importantly right now, the SARS-CoV-2 virus, which is the cause of COVID-19. Another name you should be familiar with is Joseph Lister. Lister is called the father of antiseptic medicine, and he is especially credited for improving medical practices around childbirth and around surgery in general. Lister recognized and wrote about a condition that physicians used to refer to as ward fever. Ward fever was the condition that used to be seen in post-operative patient wards in cases of women who had just delivered children, in cases of patients who had just undergone surgical procedures. While they were recovering on the ward, it was often the case that they would develop high fevers. And Lister wanted to understand where these high fevers were coming from. He was convinced that ward fever was the result of contamination of these patients by microbes. Lister believed that this contamination was coming from the environment, from the dirty hands of physicians and nurses, from unclean equipment, and a generally contaminated environment. So he started to experiment with a chemical called carbolic acid. Carbolic acid is antimicrobial, and Lister showed that if you washed your hands in it, or at least rinsed your hands in it, you could reduce the transmission of pathogens from the hands to the patient. He experimented with washing instruments in carbolic acid, with cleaning other equipment and the actual physical ward itself. He showed through his work that by using a compound like carbolic acid, we could reduce the transmission of infectious pathogens to patients and thus reduce the incidence of this ward fever condition. It's Lister who is credited with starting the movement to sterilize, in fact, all surgical instruments, all instruments that would be used during surgery in the sterile places inside the body. The final name I want us to be familiar with is another very important one, and that's the name Robert Koch. Koch is credited for developing a system in the laboratory to help determine the causative agent of various infectious disease conditions. So Koch outlined a procedure that scientists could use in the laboratory in order to say for sure that this particular pathogen was the cause of this particular disease. At the time when Koch was doing his work, scientists were coming to understand that microbes were the cause of infectious disease, but it was not yet clear which microbes were causing which disease. And it was Koch's work that helped us start down the path of tying those two things together. It was Robert Koch who, using his own postulates, was the first to show that the bacterium called Bacillus anthracis was the organism that caused the terrible disease known as anthrax.